Okay. Good afternoon, Jack.
Hi, Pearl. I'm Jack Elinson. I'm at Columbia University, and this is Pearl Zinner at the National Opinion Research Center of the University of Chicago. And we're doing this interview on behalf of the American Association for Public Opinion Research, which started more or less in 1946, or got its roots in 1946. So Pearl and I have known each other for about half a century, right, Pearl?
More. A little more.
And a bit more.
And a bit more.
So I'm going to interview you first, and then you're going to interview me.
Okay.
Okay?
Will be.
So let's start with you, Pearl. When did you first join the National Opinion Research Center?
Also known as NORC.
Also known as NORC.
Right.
Yes.
In 1951, I began to work for them as an interviewer. And at that time, I was earning 50 cents an hour. That was the going rate for interviewers.
Right.
Much more today. And it was my entry into this whole field of social science research.
And
I actually was hired as an interviewer because I was moving to Queens in New York City, and they needed somebody in Queens. So I was the person they selected through their screening process, which still is extensive.
And you've been with them ever since, for the past half century.
Just retired, January 2003.
How did you first get involved in public opinion research?
Well, it was, you mean beyond getting a job at NORC?
Yes, yes.
Well, of course, as I began to work for them, it was very soon after that that Paul Sheetsley was the person who was the director of the New York office of NORC at the time, and he invited me into the office after I had done some interviewing in the field to help work on questionnaire development. And in that process, I've been in the office since then.
What was your background that made you somebody that Paul wanted to hire for public opinion research?
I don't think it was my background at all.
Which was?
My background, I was an art major, studied to teach art at NYU, had graduated in 1941, actually. Oh, I had to think for a minute. 1941, I graduated. Then I was an Army wife and traveled all different parts of the country. But in 1951, I had heard about NORC, and I took this job. The interesting thing is that in college, I did major, or was a minor in sociology. So it wasn't so far removed from my academic training. But I did not have any specific academic training for this field.
Well, we're going to talk a lot about your 50 years or more at NORC. But I'd like to talk a little bit about AAPOR and when you first joined AAPOR.
Yeah.
And your relationship to AAPOR.
Oh, yes. Well, my first AAPOR conference was in 1955.
55.
And as I mentioned, Paul Sheetsley was the director of the NORC New York office, and he was very active, as we'll hear some more later as we talk, in AAPOR. And he encouraged me to go to the AAPOR meetings. And I think I've gone to almost every single annual conference since then.
I think I've seen you nearly every time I've been there. Yeah.
And until maybe the last 5 or 6 years, when I thought it was time for the upcoming NORCers to be going.
Okay, so now you're at NORC, and you worked on a whole series of studies for the past 50 years.
Yes.
I can't ask you to name all of those studies.
No.
But I'll ask you to name some of the major studies that you were involved in, and who the principal investigators were,
yeah.
and that sort of thing. What were some of the more important studies that you worked on?
I'll be glad to tell you about them because I considered myself very fortunate to have been involved in many of these studies. But before I go into that, let me just tell you that my role at NORC is primarily operations. I was an operations person. That meant that I directed projects and I saw to it that all the parts fell together properly. They came out on schedule, within budget. I worked on the questionnaire development. I worked on the design and the data collection and managed the data collection, and then the processing and the deliverables to the clients. We had, in New York, we had many clients, and clients were specifically principal investigators, non-NORC principal investigators. There were those, most of those were in Chicago. But in New York, they came from Columbia School of Public Health, Socio-Medical Department, Columbia School of Social Work, Columbia Bureau of Applied Research.
Applied Social Research?
Applied Social Research. So all the major units within Columbia we worked with, as well as the New York City Department of Health and other New York Hospital, for example, many health studies. So that I was very pleased to be able to work with the researchers, the principal investigators at Columbia, people like yourself, like Ann Brunswick, like Eleanor Singer, like Terry Rogers, John Columbotus, Denise Kandel. Most of these people have had their work represented or reported on at AAPOR, so that we had kind of a double duty operation going. And it was also, I should step back a minute, in that Paul, who had been the director of the New York office, and
Paul Sheetsley,
and had taught me a great deal. He moved to Chicago in 1963, and when he did that, I became director of the New York office. Mm-hmm. So in that capacity, I had administrative responsibility for all the studies that went through the New York office. That included local studies that we directed directly, as well as Chicago studies that had New York SMSA components and samples. So in that capacity, I was very careful, or tried very hard, to bring principal investigators, non-NORC investigators, into the office in New York and had them participate in the actual directing of the projects. And
they were not just remote academicians.
Not at all.
They got involved deeply in the nitty-gritty.
Maybe sometimes more than they wanted to, but but in general, yes, yeah. It was a very, I found it very rewarding, and I think they did too.
I think they got an education.
I think so. They got to know where their data came from, how it got there, and then when they were ready to analyze it, they were in a better position to understand it.
Well, tell us about some of those studies.
Yeah, okay. In particular, I think the most important series to start with were the health studies that we did. The Health Information Foundation, a Chicago foundation, funded in 1954 the first large-scale national health study collecting data on costs and medical care services and insurance coverage. In 1955...
That was a national study?
It was a national study, 2,800 households, roughly. In 1955, they did another study that looked more at attitudes and behavior regarding medical care. And these comprehensive studies that they did, they funded, and later more, were then picked up by their successor, Chaz, that was also at the University of Chicago. You recall that was the Center for Health Administration studies, CHAS, that's right.
Yes.
Odin
Anderson.
Odin Anderson was Health Information Foundation. Ron Anderson was CHAS. And then also the federally funded studies that followed in the wake of all these major health studies.
Now, these are federally funded studies trying to find out how people use health care, who uses it,
exactly,
who doesn't get it,
how they paid
how
for
often, how it's paid for,
and what kind of health care they needed, conditions. We used to collect condition data. We used to code condition data. Also, we would look at the providers that were mentioned by the respondent, as well as the pharmacists, so that there were second levels of interviewing that came out of the household interview. And that was rather innovative at the time, but it was picked up by the big NEMIS, the National Medical Care Expenditure Survey.
Those are initials for the National
Medical Care Expenditure.
NEMSIS.
There's NEMSIS and NEMIS and NEMQs and a whole series
ongoing studies done on a national basis.
That's right.
For the purposes of getting data for health policy.
Exactly. These were, the first NEMIS was in 1977, 14,000 households that were interviewed periodically over the course of 1 year. So they had longitudinal data in the whole household. We did that in collaboration with RTI, Research Triangle
The Research Triangle Institute, yeah, in North Carolina.
Yeah, remind me to spell out these acronyms. Right. So these were very important health studies that have, and still do, provide the data for federal policy regarding health care and Medicare and Medicaid. Which brings me to another important study that I feel is particularly important. That's John Columbotus' study that he called Physicians and Medicare.
My colleague at Columbia.
Your colleague at Columbia. And it had to do with looking at the impact of legislature on actual behavior, social change. And indeed, when the AMA was very much against Medicare at the time, and against Congress passing such a bill.
This was in the early 1960s. Yes?
1965,
65,
as a matter of fact. Before the bill was actually passed, I think, in 65. We did
the Medicare bill.
That's right. We did 3 waves of interviews. The first one was pre-Medicare. The second was about 10 months after the bill was passed, or after the bill was passed but before implementation, and the third one was after implementation. So that initially the AMA was sure that the physicians would boycott the program. There was no signs of that at all. And then, as we did the follow-up interviews, the support, or in favor, of the Medicare hospitalization Part A, that we know, rose from 38% to 70%, and then after implementation, 81%.
Which shows that physicians' minds can be changed with legislation.
Well, that's the point. Or maybe they never fully supported what the AMA Executive Committee was thinking.
But you show that they were...
They definitely changed.
There was not a majority in favor of it at the beginning.
Well, that's true.
Before
that's
Medicare.
True.
But
that's true.
They were opposed to Medicare.
That's true.
Before the bill was passed. After the bill was passed, and they got to benefit from all these additional patients being paid for by the federal government.
That's right.
Medicare and Medicaid, by the federal government and the state government.
Right, exactly.
Somehow their minds got changed.
Exactly.
And then the majority were in favor of medical care.
Exactly.
Medical care paid for by the government.
The Medicare program. They were definitely moved to a favorable position, which is the point that John was trying to demonstrate, and in fact he did. The other interesting thing about that study was it was a telephone survey, and it was one of the first NORC telephone surveys. Not the first, but close to the first.
This is 1965.
1965. And John wrote a very good paper that, in fact, was reported or presented at an AAPOR meeting in Connecticut in May of '65, where he looked at the data from several questions of a random sample of respondents interviewed on the telephone and respondents interviewed in person. And the differences were negligible. That's an interesting
even John
paper.
was convinced that
Yes,
it was possible
John
to
was
do
convinced. and
telephone interview surveys with a good sample and get good results.
Good data,
Yeah.
absolutely. And in fact, Seymour Sudman also presented a paper.
And Seymour Sudman was a statistician?
Well, Seymour Sudman, yes, he was actually our sampling person at NORC,
Sampling statistician,
then moved to the University of Illinois.
yes.
I'm not certain, this paper may have been somewhat later, but he cites the Columbotus paper in his paper on that same subject of it's called New Uses of Telephone Methods or something like
Right.
that.
Which is pretty common nowadays.
We don't even think of it that as calling new uses. I mean, to us today, I mean, it's so routine.
Now, what were some of the other substantive areas that
Yes, I'll tell
and
you.
other major studies that you were involved in?
Yeah,
With
there were-
Columbia people?
Some were, but not all.
Yeah.
In fact, there was another health study, a lot of health work in New York, that was a New York Hospital Cornell project. And there is a book published on the findings of that study where New York Hospital wanted to check the feasibility of providing medical care to a welfare population. They took, and this was 1960 to 1964, I think, and they took a sample of welfare recipients, randomly divided them into study group and control group, and the study group was then again divided into two groups. One had an appointment for a physical offered to them immediately. The other group was allowed to come to the hospital for their care whenever they felt they needed it. NORC interviewed these respondents for over 2 years, and we got data that the research staff could never have gotten on medical services used by these respondents, because there was no way to know where they went unless we had picked this up in the interview. So we got utilization data as well as medical data, condition data, etc. The findings are numerous.
What's the main finding on that?
Well, in summary, I can tell you that it is feasible for a teaching volunteer hospital to provide medical care to a welfare population if they have an identified staff that follows the patient, takes a personal interest in the patient, coordinates their health care, and takes as their responsibility the making of these appointments for physical examinations. In other words, they found a much better responsiveness to that group than the ones who were left to come whenever they felt like it or whenever they thought they needed it.
Now, that study was done for Cornell.
It was Cornell.
And New York Hospital.
New York Hospital.
And you did many studies for Columbia as well.
Well, we did. But
Yeah.
let me just cite the authors of that study in case anybody ever wants to look them up.
Okay.
It was Margaret Olensky, who
Yes.
had her doctorate, and Charlie Goodrich, who was an MD,
A physician, yes.
and George Rita,
Who was
who
a
was an
physician
MD.
and sociologist.
Yes.
Yes.
And they were the authors of this, of the book on the findings of the New York
I-
Hospital Cornell project. And I think it's a very interesting book, and it has a lot in it, but I'm not, citing all of it to you now.
Right.
So, well, other studies that
What about Columbia? Didn't they do it? Use NORC to do some studies?
They did. We did studies for the Bureau and Columbia Uptown. I don't have all the details from. There was an interesting study that we did from the Bureau, but I don't have my reference material.
I think you did
it.
some studies in the area of drug use.
Well, we did a very important study. It was not for Columbia, though. It was called DARP, Drug Abuse Reporting Program. And it was 1974 and 1982. There were two waves. This was a man by the name of Sol Sells, a Texas Christian in Texas. And he was the principal investigator for the first wave. And a man by the name of Dwayne Simpson at A&M, I think, in Texas, did the second one. But this was the first large-scale national study of people who had been through drug treatment programs. And we followed them all over the country and got an excellent completion rate, 79%, 82%, in spite of the fact that we were asking for illegal behavior and drug use. And as a matter of fact, this was maybe the first one that I'm familiar with where the names of the respondents were kept out of the United States. They were in Canada because of the kinds of data that we had collected.
Which, if put together, might be basis for criminal activity or illegal activity?
They were. And it did indeed, the finding of that study, I understand, has indicated that different kinds of treatment programs could predict how the drug user would behave in the future.
Speaking of drugs, I think one of our Columbia people,
Johnston.
Denise Kandel.
Oh, Denise.
Of
course.
Didn't she use
Yes.
your services for doing her studies of teenage drug behavior?
Absolutely. That study, in fact, we've done it several times. I think we're doing one right now, actually, for her out of Chicago. Her study started
This is some
in
30
school.
years later.
Yeah. Oh, easy.
Yes.
More, maybe. Her sample was an in-school sample.
Yes.
Where we would go into the schools and have them self-administered. And then there were some components of it, and sorry I don't know the whole design of it. I don't remember the entire design of that study, but I know that we did interviewing as well. It might have been people who were not in school on the day that we were doing the in-school survey, or there may have been follow-ups.
I recall one of the significant findings from that study.
Yeah, perhaps you can tell me.
Well, you did the work to get that for Dr. Kandel.
Yeah.
But one of them is the predecessor of marijuana use was cigarette smoking.
Oh, I think I remember that.
And cigarettes was a lead-in to marijuana use, which subsequently was a lead-in to use of more serious drugs like heroin, cocaine, and the like.
Yeah.
And that's one of the major theories that Denise Kandel exploited based on the studies that you worked out with her.
The data that we collected, yeah.
You also did other health studies with another colleague of mine, Anne Brunswick. Did you know?
Anne, yes. Her sample came out of Harlem. She had an area probability sample.
Yes, that was my sample.
Your sample?
Yes.
It was out of your sample.
Yeah, she took the adolescents.
The adolescents of that household sample.
Right.
And we followed that sample a number of years.
How many years, would you say?
There were big lapses between So
Between waves.
They were, from the time they were adolescents when we first did them, until they were 30 and 40 years old.
So you followed them for over 20 years.
Yeah, yeah.
The same individuals.
The same individuals, yes.
Yes.
There may have been like a period of 5 years between interviews, but they covered
that would be an enormous task in trying to trace these people and finding out where they are. I understand some of them were in jail and some of them were...
some died.
Some died.
Yeah.
I don't think you interviewed them, but...
But Anne did a very good follow-up herself. She used to, as I recall, she used to send either birthday cards or some communication, contact with the respondents in the interim years, so that when we went to follow up, she had already done a great deal of work. But this reminds me of another important study that we did for, it was called the Midtown Manhattan Study.
You worked on that?
We did indeed.
For Leo Stroll?
Leo
the famous
Stroll.
Study of mental health in the metropolis?
Exactly. Yeah. And the first wave of that was in the 50s. Thomas Rene was the
physician, the psychiatrist from Cornell.
Principal investigator.
Yeah. But Leo Stroll was the sociologist who was the study director.
The follow-up wave also. And NORC did the follow-up wave, which was 20 years later. And we interviewed respondents everywhere, include those, of course, who were still in New York, and those who traveled all over the world. We did interview them, and that interview ran about 4 hours.
4 hours?
Very long, open-ended. It was an amazing interview.
Not a typical interview.
Not a polling type interview. No, not.
Right.
What was so interesting was that because it was so salient to the respondents, we had no difficulty with cooperation.
There were many famous findings from that study. I recall one of them which showed that married men were happier than married women. And that
than married women. Oh, I thought
men got more out of marriage than women did, at least as far as being happy about being in a happy state.
Well,
I remember Leo Stroll and I went up to see Moynihan, who was then at Harvard.
Yes, yes.
And he reported on that study, and I reported on a study I had also done through NORC, the Hunterton study of chronic illness, which
we're going to talk
about later.
Yes,
but
that's right. Well, I worked personally with Leo Stroll.
So I think you were involved in many significant health studies, mental health studies, drug use and drug attitude studies, and this follow-up study of adolescent health study that Anne Brunswick was
We've
carried
done
forth.
Many studies for her. So, this was a very full and rewarding career.
I would say so. Tell me about the NORC AAPOR connection.
Yeah, let's talk about that a little bit.
Okay.
Paul Sheetsley, who unfortunately died during
the editor of this.
He was the editor.
A meeting place. I remember working with Paul on this.
Yes.
Which is the definitive history of AAPOR up to that time.
That's right. And he wrote in the introductory chapter about how Harry Field, who was the NORC founder in 1946, had called the well-respected people in the field of social science research, both in the United States and in Europe, to a 3-day meeting at Central City in Colorado, because NORC at the time was at the University of Denver.
Yes.
And
I recall.
He called, that's right. So he called this meeting together to see what this group would think about the possibility of a professional organization. And indeed, the group decided that there should be one. And the following year, I don't have to tell you this, except to point the connection between NORC and AAPOR, the following year at Williams College was when they actually developed the framework for AAPOR. And
indeed, Clyde Hart was the director of the National Opinion Research Center.
At the time.
Also became
the
an
first
early
president.
The first president
of
AAPOR.
That's right. He was an NO, and he became director because, unfortunately, Harry Field was killed in a plane accident.
Yeah.
And in the interim period, so Clyde Hart took over, and he then became AAPOR first president. And of course, NORC has provided several presidents of AAPOR. Paul Sheetsley was a president, as was Norman Bradburn. And over the years, they've also, many awards came to NORC people. Paul Sheetsley got an award.
Herb Hyman?
Well, Herb Hyman. Now, Herb and Paul worked very closely, you may remember, on the interviewer effects study.
They did a series of classic studies on interviewing.
That's right, and the impact and the effect of the interviewer on the interview itself. And so there was Herb Hyman, but I don't think he ever was NORC.
No, but he
worked closely.
At Columbia, he
Yes.
and Paul Sheetsley
That's right.
worked on these studies together. Hyman was representing the university, and Sheetsley representing NORC.
That's correct.
And together they produced a magnificent set of studies defining what interviewing and social research was all about.
That's right.
Yeah.
That's right. And he, of course, was a president of AAPOR at one time. And there were the awards that were given, the Julian, is it the Julian Woodward
Early
Award?
on, the Julian
went to Clyde
Woodward
Hart.
Award. Yeah.
And again, Paul got an award. Norman Bradburn and Seymour Sudman got a joint award. Tom Smith, who is currently very active at AAPOR, and another staff person at NORC whose name is Lee Leffis. They got a joint award for developing the database for the General Social Survey. They got an AAPOR award in the year 2000, which was,
so they keep winning awards.
We're still very heavily involved. I was chair of the chapter relations committee at National AAPOR in '82 and '83.
AAPOR has chapters
they have
around the
5
country,
or 6,
in New York and
Midwest and
the
Far
Pacific
West
and
Washington D.C.
area.
Yeah, and they're very active chapters. And there is a committee on the council, the National AAPOR Council, that kind of keeps track of what the chapters are doing and coordinate their activities. And I did chair that committee one year with Selma Monsky, who was at NORC Chicago.
Field director. Yes.
Even before I came.
Before you came?
She was there when I came to NORC.
I guess she was there before I came as well.
Well, I guess, but then she left NORC. She left, I think after Clyde Hart retired. She left. There was something, and currently we have large numbers of staff. Cullum O'Murgatagh, I don't know if you know Cullum.
The sampling.
He's a sampling
statistician.
Rachel Harder, who is our sampling person. People like Ken Rosinski, who does a great deal of methodological research, and numerous others. Charlene Weiss, who is our field person.
Lester Frankel was a member of NORC, the sampling statistician.
Marty Frankel.
Marty Frankel. Lester was his father. Yeah.
Right. He was quite a while ago,
Yeah.
but he hasn't been with NORC for quite a while.
Yeah.
But he was sampling statistician. We now have, of course, a much larger sampling department than we did at that time.
I would suppose so, right.
Yeah. So that's sort of the story.
Well, I remember visiting NORC in Chicago a few years ago, and there's a huge portrait about the size of that wall over there.
Well, that's a slight exaggeration. It's a
Of
good
Pearl
size.
Zinner, and you were extremely highly regarded there.
Yes.
And you tell me there's also going to be a celebration
In April, this month.
later this month, in April of 2003,
For my retirement.
to celebrate your retirement, if you're
Right.
really retiring. It's hard to think of you as retired, but you do it.
Yeah, I am. Pretty much.
Yeah.
But still glad to be affiliated.
Okay. Well, you mentioned Harry Field
Yeah.
calling together
The Central City people.
people in Central City, Colorado in
Right.
1946,
Right.
calling people from academia
Right.
and the pollsters like George Gallup and
Right.
Arch Crossley,
Right.
and some people from government.
Like you.
And this is where I come in.
That's right. So tell me about that.
All right. I was working in the War Department at the time,
Uh-huh.
which later became known as the Defense Department.
Uh-huh.
But I had working in the War Department, and I represented the War Department. The illustrious figures in the War Department had all left after the war was over
Uh-huh.
and went back to their universities. People like
Who?
Sam Stauffer, who was also active in AAPOR at the very beginning.
Uh-huh.
Other sociologists like Leonard Cottrell and Arnold Rose, sociologists. Louis Gutman, who
Oh, yeah.
might be known to
Yeah.
some people in the social research field
Yeah.
for his work on unidimensional scaling,
Uh-huh.
and psychologists like Carl Hovland, who was president of the American Psychological Association, and Fred Mosteller, who was president of the American Statistical Association, and later, I think, president of the American Association for the Advancement of Science. Actually, my graduate work was done in the research branch, the attitude research branch of the War Department.
Ah.
And I was left over because I was a kind of junior member. I didn't have my PhD yet.
Uh-huh.
And so I needed to work and earn a living for my wife and children. So I stayed on for another 5 years in the War Department or Defense Department, doing research there, and also not joining NORC till 1951, which is about the time you joined.
Yeah. Yeah. So tell me, how did you get to NORC?
Well, there's a little story about how I got to NORC. I was called on, I had a visit from Clyde Hart, who was the director of NORC. It seemed that NORC was asked to do a study of chronic illness. There was established a commission, a national commission on chronic illness, based in Chicago. This national commission was set up by all the professional health associations, the Medical Association, the Public Health Association, and the various disease associations like heart and cancer and so on. Because chronic illness was getting to be important in the country, and they thought they pretty much had control over the infectious diseases. This is before AIDS and before SARS.
Yes.
long before SARS. But at that time it was felt that the interesting areas were the chronic diseases, and they wanted to get some estimate of how much chronic disease there was in the population, and what was being done about it, and what their needs for care were of such people. So I happened to have done a few health studies in the war while I was in the War Department, the research branch. How did I happen to do that? Health studies were not regarded as very serious sociological studies. So all the senior people in the attitude research branch of the War Department worked on serious matters. Why men fight. Discipline, attitudes towards discipline. Social issues like race relations in the military. Those were serious social psychological questions which the senior social scientists, like the ones I have mentioned, also Robin Williams, John Clausen, and other well-known people of that kind engaged in. When it came to doing health studies, a request from the Surgeon General came in, for example, to find out about what is the effect of a trench foot on soldiers, morale, well-being, and so forth. They gave it to the junior member of the staff, which was me. So I became known as the health person because these were not terribly interesting studies, health studies, not big social theory studies, not something like Lazarsfeld would be consulting on or Bob Merton would be consulting on. And they were giving it to me because I had learned how to do survey research in this group of people. I learned about sampling. I had also taken a course with Steve Stock and Lester Frankel. And Abe Jaffe was the sampling statistician, happened to be my brother-in-law. Oh. So I learned about stuff from them. So that my graduate education really took place in the attitude research branch of the War Department. And I became known as a health person. And Shirley Starr, a name we haven't mentioned yet.
Oh, yeah.
But she was a colleague of mine in the War Department. Actually, we had a partner's desk. She sat on one side, I sat on the other. We got to know each other pretty well. And when, after the war, she went back to finish up her doctoral work, her PhD, at the University of Chicago, and to take a job with the National Opinion Research Center.
Absolutely.
So when this health study request came along to NORC from the Commission on Chronic Illness, she reminded Clyde Hart that I was the person in Washington who did health studies in the attitude research branch. So that was my invitation from Clyde. He came to visit me, and he, of course, knocked me down $1,000. Clyde Hart was good at that.
He was a good manager.
That's one way of putting it. And I went to NORC in 1951 to do this study of chronic illness in a rural area. This commission had asked for a study in a rural area and in a urban area because they didn't have money enough to do a national study. And that was going to be the first study ever which used a probability sample of a population, a community population, and examined, physically examined, did thorough clinical examination, not just asking questions and not just filling out questionnaires, but examining people. This was the first such study, I think so, ever done in the United States and perhaps in the world.
I think so.
So I became known as the health man at NORC as well.
See that?
Having been graduated from the War Department to the National Opinion Research Center. The first meeting, as you recall, was held in Central City. And he had all these...
What were some of the main issues that came up there?
The main issues, as I recall, here we are in Central City, up in the beautiful mountains there, and we had our meeting in the Opera House in Central City, and these hotshot pollsters, Gallup and company, academicians, social psychologists from various universities, and a few government representatives like myself. One of the main issues, which is described in a meeting place, I wrote a chapter on that and on methodological issues that took place that were discussed, was the introduction of probability sampling. Now this was, probability sampling had been worked out practically as well as theoretically by Census Bureau employees, by Morris Hanson, who was a mathematical advisor to the Bureau of the Census, and he introduced the notion of probability sampling. There was a big reaction to that at this first meeting because none of the invitees, the famous people, the Gallups and the Crossleys and so on, or even the academicians did probability sampling. They did what they call quota sampling. Everybody knows what quota sampling is. You find out how many older people there are in the country, and so you make sure you have this number of older people in your sample.
Right.
How many males there are, how many female by
Right.
gender,
Right.
and as many demographics as you could.
Right.
And you filled out
Filled
these
your cells.
these quota cells.
Right.
And there was no such thing as a refusal then,
No.
because you just went into
To the next one.
you found somebody who met that characteristics.
Right.
So there no even computation of a refusal
The
rate,
rates.
which seems to be a matter of great concern
Of
to
course.
current pollsters and survey researchers.
Sure. Or completion
So,
rates
so that was, I think, maybe the main methodological
issue. Yeah.
issue, and Mars Hansen, the eminent statistician, held forth, and he convinced a lot of people that it was important to think of probability samples and be able to compute
Yeah.
sampling error from a known probability
Yeah.
sample.
Well, it did move into NORC. Initially, we did quota samples.
Yes, you
I
did.
remember doing them.
Yes.
And,
Well, I think most people did.
yeah, but it
and,
did move to area prob.
Well, at
very
least from
early.
a theoretical frame
Yeah.
of work, and the government was able to, they're more costly, I believe, because you have to get a certain designated
Absolutely.
individual
And
or household,
Absolutely.
and not just anyone who met a certain
And you had
quota
to have
on
a frame.
characteristics.
You had to have a frame in the
You
United
had to be able
States.
to frame, you had to
You had
know.
a screen, and you had a list, and you had to have all of these data of all the households.
So I think Hansen won the day, at least in my
He
in my
said-
estimation.
Yeah.
Although there were a series of articles that were published debating the benefit of quota samples
Yeah.
versus probability samples. And that might have been the single most important methodological issue that was
Yeah,
discussed.
I can imagine.
Another methodological issue was one that I introduced, which I had learned about from Louis Gutman in the War Department. This was on scaling
Uh-huh.
and the unidimensional scaling. That
Uh-huh.
people talk a lot about question wording then, they talk about it now. It's an unending discussion.
Absolutely.
And how you ask the question in an unbiased way.
That's right.
And Gutman had a revolutionary idea of thinking about it. He thought of a universe of questions, and we take a sample from them, not a probability sample, but just a pickup sample of questions, and each of them tapping that same dimension, the
I
same
see.
attitudinal
I
dimension,
see.
so they could give people a score, a meaningful score, who was more in favor, or the idea of more or less was a very rigorous kind of thing. You answered more questions in a certain way than somebody else would, so you got a higher score.
I see.
So I introduced that at the first meeting. That was my
Uh-huh.
contribution
Wow.
to the first meeting of AAPOR.
Uh-huh.
On the same program as Herbert Hyman,
Uh-huh.
who talked about validity
Uh-huh.
of questions.
Yeah.
If you ask
Yeah.
people questions, how valid is it? Well,
Yeah.
you can't check an attitudinal question, but you can check factual
questions.
He asked questions like, do you have a library card?
Right.
And
And did you vote, or did you register to vote?
did you register to vote? Do you have a driver's license? All of which were checkable, and he showed how you can check these kinds of questions
right,
out.
Right.
So
Those were
Hyman and I were
important issues.
on the same
Yeah.
program at that time.
Uh-huh.
One of the most interesting issues was raised by Joe Belden.
Yeah.
Joe Belden had started the Texas poll.
Yes.
This was like a Gallup poll, but restricted to the state of Texas.
Right.
And Joe raised an ethical question.
Yes.
And that question was, here he had done some polling in Texas, and a certain liberal candidate, I think his name was Rainey, was one of the candidates.
Uh-huh.
And it turned out that black voters were more in favor of Rainey
Uh-huh.
than white voters.
Uh-huh.
And Joe raised this ethical question. If he were to report that,
Uh-huh.
he thought that people would vote against Rainey
Because
because blacks were in
Voting
favor
for
of
him.
Rainey. and he raised the question: should he report that, or could he withhold that, or should he withhold that information? He raised that question in front of the big pollsters, George Gallup and Arch Crossley and those, and I don't recall his answer. And we've got to get Joe Belden to tell us that story.
Yeah.
At least we could ask Nancy Belden,
Yeah.
who's his daughter and
Maybe
who's
she
in this
knows.
and who's in this research business with her both feet, and to see if he can recall who said what at that particular time.
Yeah,
I remember
and
the question
when.
being asked,
Yeah.
but I don't recall the
answer. That's a cliffhanger.
That's a cliffhanger.
Well, that's interesting. And then, of course, the whole discussion at Central City about whether or not there should be an organization.
Yeah.
That took place at Central City also, didn't it?
Well, yes.
Should there be one?
Yeah, and as you say, Field was killed in in an airplane crash. But the following year, I think the meeting was at Williamstown, was it?
Williams College.
Yeah, in Williamstown.
Which is in Williamstown, I think, yes.
I think it was decided that year, yes, it's worth. So here we have these academicians, or academicians, these government people, these commercial market researchers, and these public opinion pollsters, all using a same method, taking a sample of a large population and asking them questions. I recall the first T-shirt that AAPOR had, and the slogan on the first T-shirt, AAPOR gives prizes for slogans on the T-shirt, was, if we want to know your opinion, we'll ask you.
That's right. Otherwise, keep it to yourself.
AAPOR was a fun place, right? And they had these T-shirts.
Oh, yeah.
And a couple of other that I recall, which are worth mentioning, is which won the T-shirt prize. I think they got a free T-shirt, which was the truth, the whole truth, and nothing but the truth, plus or minus 4%. Right. And the
margin of error.
And the most recent one, or at least the last, was this last year's, or
I don't.
Maybe a couple of years ago? When was the last election?
Well,
in the year.
A couple of years ago.
Yeah, and that, Alan Barton, I think, contributed this one.
Oh.
Something like this. This was the first time that the polls were more accurate than the election. Right.
That's a good one.
Right.
Well, but it is a fun place, and still is.
It's grown some. There are, some 1,500, 1,600 members, although we were only a few hundred at the beginning.
Yeah.
And now it's a solid group of commercial pollsters, market researchers and pollsters and
I guess,
academicians and government people.
I guess a thorny question for AAPOR that still exists is the whole issue of the Standards Committee and how to keep and get members and non-member organizations to comply with standards.
Mentioned standards, because one of my jobs at AAPOR was to be a Standards Committee chairman at one point.
Yeah.
And that led to AAPOR's becoming incorporated.
Yes.
It came about this way. There was a market research firm who used polling or surveying to find out what the potential customers were for different kinds of automobiles. They asked them, what do you think of this kind of automobile? Would you be interested in buying one? Then they would turn over the names of the people they polled who said they were interested in buying, let's say, a Ford or a Chevrolet to respective dealers in the area. And as the Standards Committee, of which I chaired at the time, thought that was not an ethical thing to do. It was not using polling. It was misleading the public. They weren't really trying to find out what their opinion was, but they really were looking for customers for their commercial organizations. So we chastised this commercial company for misusing polls in this way. We got a reply, I won't name the company, we got a reply saying, if we persist in doing this, they'll report us to the Federal Trade Commission as a conspiracy in restraint of trade, because we were infringing on their right to do, on their way of doing business. And we'll sue you individually and collectively. So we quickly called a meeting, and Paul Clapper was a member of the meeting. Joe Clapper.
Yeah.
Paul Clapper was his father, who was my teacher at City College.
I see.
Taught me statistics at City College. And yeah, Joe Clapper, who worked for CBS, who's head of research. We took the case to the attorneys at CBS, and they said we better get incorporated.
Yeah.
And that year we became incorporated. So that if anybody sues AAPOR now, they're suing a corporation that it doesn't have a very big budget, as you know.
Yeah.
It doesn't have a very big treasury, and
Sure.
but at least it protected the individuals from being sued.
Yeah.
So that's reported here in this meeting place again by a great chapter. I think one of the best chapters in the book there by Sidney Hollander on standards.
Yes,
on
that
standards.
was a very hard issue, and still is. Yeah.
We still wrestle with that. What to do? We have standards for our standards and ethics for ourselves, which we swear to that we'll uphold.
Yeah.
But we have difficult time convincing people who are not members of the association to adhere to standards like that.
Yeah.
And to educate the public.
Yeah.
And to educate the press.
Yeah.
To saying what is a well-done poll, what is a quote, scientific poll,
Yeah.
what is a good sample, what's a good response rate.
What can we rely? Where can we rely on the data that
and
comes?
that sort of thing.
Sure. Sure.
So
Well.
that I was also president of AAPOR at one time, and I think the most significant part of my presidency at that point was to appoint Donna Charon,
Yeah.
as chair of a history committee. And that led to
Did that?
this volume called A Meeting Place,
did it?
which
Did it?
Warren Matofsky
Did it?
took over from Paul Sheetsley when Paul Sheetsley was no longer with us, and he wrapped up this book, and as well as contributing a chapter to
Well,
it. So
that was a good move.
that was during my quote
That was a good move on your part.
reign.
So you were chair of the Standards Committee. You were
Yes.
president.
Yes.
What other? Do you have any other offices?
Well,
at AAPOR, or?
You know what they do with older folks? They
Yeah,
put
they
us on the council, as they call it.
Yeah.
So you can contribute
ex officio or
contribute what knowledge you have, and so on, to deliberations of the executive committee. Without a named office.
So let's hear a little more about your health studies. You started to tell us about coming to NORC and doing the chronic health study, but you didn't tell us about the important finding from that study.
Well,
we got sidetracked into something else.
In this first study that I did at NORC, the Hunterdon County study in New Jersey.
That's the one.
It was a study of chronic illness in a rural area. We not only interviewed a probability sample, I think, of a 40,000 member community. We interviewed, I think, something like 4,000 families. But we also examined clinically and invited people in for examination, clinical examination. This was the first time that was done in any kind of health survey. The interesting effect of that was, at the very same time, on a national level, there was a committee set up a national health interview survey to be carried out by the Public Health Service. And they were just going to do a probability sample. They had excellent statisticians, Harold Nisselson and Mars Hansen, as I mentioned before, and Hurwitz. Hansen and Hurwitz had written a book, or were about to write a book on how you do sampling and so on. So sampling was a new thing. It wasn't the first time that the Public Health Service did a survey of the country. They did one in the Depression. They interviewed millions of people.
Did they?
Millions of people around the country. There were a lot of unemployed people willing to be interviewers, doctors, lawyers, engineers, school teachers, and so on. And they just interviewed several million people, and it was, you know, it was a very, very good survey for the days. But that was before the introduction of probability sampling into population surveys. That's so. This first examination now showed quite a bit of difference between what could be found out on an examination and what could be found out in an interview. On an interview, people tell you how they felt, what hurt and didn't hurt, whether they felt sick or didn't feel sick, whether they had been to see a doctor, whether they'd been hospitalized, and what the doctors told them. And they were pretty good at remembering what the doctors told them. And because we also surveyed the doctors, and yes, the doctors would say, yes, that's what the people had. So that was legitimate for that kind of. But many people had never had a thorough clinical examination. They didn't know they had a lot of conditions. And it turned out that there were 4 times as many serious, chronically disabling conditions found in the examination than were reported on in the personal interview, in a thorough personal interview, just the way the Public Health Service was planning to do personal interviews. Well, they called me down to Washington. They called Trussell and me down to Washington. Because
by that time you went to Columbia? You had gone to Columbia, where Trussell was?
Yeah, by that time, yes, that's right.
You had moved from NORC.
I moved from NORC. Ray Trussell was the medical director of the Hunter Medical Center, and he was my collaborator on this chronic illness survey. And in order to finish up this survey, get the data analyzed and out, Trussell had become the dean of the School of Public Health at Columbia University, so he invited me to join him as an associate professor at Columbia. Which I did, and that's where we finished up the analysis and the writing up of the study.
So you were saying that you went with Trussell to the government.
I followed Trussell a year after he joined Columbia University. He had been the director of the Hunter Medical Center, and then he went to become the dean of the School of Public Health, or the director of the School of Public Health at that time, as it was known, at Columbia University. And in order to head up research of the kind that he and I had done at the School of Public Health, he invited me to join him, and that's what I did a year after his coming to Columbia. But now, what happened, the consequence of that study, the committee composed of Hansen, as I mentioned, and Elinson, statisticians, and Hurwitz, statistician, invited me to, after our presentation at the Public Health Service, they invited me to dinner at Hansen's house. Mrs. Hansen cooked a tremendous meal. Of course, we had drinks just beforehand, and Mrs. Hansen prepared an elegant dinner. And Harold Elinson told funny jokes about sampling. And after they were in a good mood, the inquisition began from Morris Hansen. Just how Ted Woolsey was there as well, who was director of the Public Health Service.
I remember him, yeah.
Or not the Public Health Service, but the having to do with health statistics, National Center for Health Statistics.
NCS, yes.
How did I go about this, comparing interviews and examinations? I had the forms with me. I put them down on a table like this. Here we listed on this side of the page, we listed the diseases reported, the conditions reported by people in the interview. Here on the same page, on the opposite, that we put down the conditions that were found by the physical examination, the clinical examination, found by the clinicians. We matched them. We tried to match them. Yes, this was a perfect match. That gave us certainly. This one is probably good match. This was modest match. This was no match. And it turned out we were able to match, a certain proportion of them, but we couldn't match 3 out of the 4 clinically determined conditions.
See that? Yeah.
Yeah. So that piece of paper, which I happened with me, when the committee went back into action Hansen and Hurwitz and Woolsey, this national committee, they decided that year, in 1957, to also have a national health examination survey as well as a national health interview survey.
Yeah.
Because the things you can find on a health interview survey are perfectly good.
Yeah.
People can tell you how they feel.
Yeah.
They can tell you what they did. Did they go for medical care or not?
Right.
They can tell you, did they go to work? Were they able to work or not work? Were they disabled from... That people can report. But they cannot tell you what an X-ray machine can show you.
What they don't know.
What they don't know.
Yeah.
What a blood test can find, what urinalysis, the whole armamentarium of clinical medicine.
Sure.
But they decided to have also a health examination survey. So since 57 then, while we've been having a national health interview survey, and have taught many countries around the world how to do this, periodically, not every year, because it's so much more difficult, as you might imagine, and to set up a probability sample of people to be examined clinically, to recruit the examiners, and have sampling points around the country, and where people could be called in. So we also have a health interview survey, and now we have a health examination survey done periodically.
Right.
Not as often as the health interview survey, because it's too expensive to do that. To do that. And they don't always do an entire population. They might do an age group, adolescents this year, older people that year, adults this year, and so on. So I think that was a major contribution of NORC's study. And I'm proud to be associated with it, of the Huntington study of chronic illness.
Do you happen to remember in your analysis of those data, was there a difference in findings between different age groups?
Yes.
So,
well, older people had more visits to
and
doctors.
More conditions.
And had more conditions, yes.
That's right.
Actually, these clinicians, we had to define what a chronic condition was. They defined a chronic condition as one which is currently disabling, or potentially disabling.
I see.
And that included non-manifest conditions, conditions without symptoms. For example, high blood pressure.
Oh, yeah.
For a long time, that can be symptom-free.
Yeah.
So they're late, non-manifest.
Yeah, and no way of knowing. The respondent may never know.
That's right. As a matter of fact, there was a study once done which showed that comparing people who knew they had high pressure with people who didn't know they had high blood pressure, and they both had high blood pressure, but those who knew and those who didn't know, those who knew were much more unhappy than those who did know. The story, famous story by Mary Monk. It affects how you feel about yourself. I sometimes say my doctor makes me sick by telling me what is wrong with me, which I didn't know before. So that health examination survey continues to this day.
Yes.
Periodically, as I say, just as the National Health Interview Survey does.
Yes.
And I think that was a major contribution of the
Absolutely.
NORC's undertaking this study for the Commission on Chronic Illness.
Absolutely.
That resulted in my Trussell inviting me to join the research staff here at Columbia. Trussell saw that somebody who knew something about, was a social scientist and knew something about sample surveys, would be useful in the public health field, because public health is about populations. And of course, he was a clinician. He was internist, also had an MPH, Master of Public Health, from Johns Hopkins. He had studied venereal disease among the troops in the Pacific Ocean areas. And we worked together pretty well. And he saw that I knew something and could help out. And I, of course, knew that he could help something in a medical way. And so that started a research group at the School of Public Health at Columbia University.
Which is in full bloom.
It's full bloom now. Not only did we do research, but we also did some teaching. And we started a group called a Department of Socio-Medical Sciences at Columbia. in the School of Public Health.
Yeah. Yeah.
We're composed of anthropologists and sociologists
Yeah.
and psychologists, particularly social psychologists.
Yeah. Wonderful department.
So it's now, I think, the largest department in the School of Public Health.
Yeah. That's a far cry from the beginning.
It was an issue of what to name this department before it was department. Oh, until I came to the school, when I came to the School of Public Health as a faculty member, I would not have been allowed to enroll as a student.
Oh.
I could be a member of the faculty, but I didn't have the qualifications to be a student. To be a student, you had to be a health professional of some kind.
Oh.
You had to be a physician, or a nurse, or a dentist, or a veterinarian, or a sanitary engineer, or a hospital administrator. You had to already be in the profession in which you would get then. I think this is true of all schools of public health, not peculiar to Columbia, but to the dozen or 15 schools that were present.
And in what year was that?
What year was that?
Yeah.
I'm very bad on years. Well, when I first came to Columbia?
Yeah, well,
that was true. That was true when I first came to Columbia in 1956.
Yeah.
And until the mid-60s, social scientists didn't get into schools of public health.
Well,
but we thought it was useful to have Trussell and I, with his support, thought it was useful to have social scientists come to the school. But we couldn't get them into the School of Public Health. What did we do? I used my AAPOR connections. I used my AAPOR connections. I knew Herbert Hyman, who was on the faculty in sociology and on the lower campus at Columbia, as we call it.
Right.
Paul Lazarsfeld. And Trussell and I went down and we talked with Paul Lazarsfeld and Herb Hyman, and we suggested that they introduce into the graduate faculties, which control the Doctor of Philosophy degree, that if they control that, to allow students to come in to a program which would have half the work being done in the School of Public Health and half in the Social Science Department.
Right. So
and they gave us a trial period of 3 years, and then another trial period of 3 years, and it eventually won out, and now we have this program. The PhD comes from the graduate school. The Doctor of Public Health comes from the School of Public Health.
Right.
So now we can have social scientists. And now I think all schools of public health in the whole country admit social scientists one way or another. They call them different things in different schools, behavioral science departments or socio-behavioral science departments or whatever.
Right.
We called ours
medical sociologists.
We called ours socio-medical.
Socio-medical. And so all the people we worked with, I'm sorry.
Yeah. Trussell asked me to think of a
name.
What should we call it? Well, we were first called administrative medicine because that was the department that Trussell was the head of, and I was a member of administrative medicine. But then he let me have a free rein to name it anything I wanted, and we tried a few names. I had a Greek colleague, Stamatina Kouvari, and she thought we wanted something which say something about social and health and be a science. So she thought of a word, kinan ihia, which in Greek I think means upon the people, ihia, hygiene. Well, I didn't think that would fly. I see you squinching your eyes. I didn't think it would fly, and she didn't see
Nobody could pronounce it.
why that should be, but anyway. So I've tried out one called socio-salustics. Socio, okay, salu, health. Ix, you need an ix or an ology to be some kind of science. Well, that didn't fly either. It appears in a few textbooks somewhere. I wrote a chapter once for methods of socio-medical research in a book on Handbook of Medical Sociology, and it appears there. That book was translated into a number of languages around the world and become a fairly general, well-known textbook, Freeman, Levine, and Reader textbook, in 3 editions at least, maybe 4 now. And I remember a Japanese colleague of mine sending me a copy of the book and the translation of my chapter. And I saw my chapter, of course, in Japanese script. my name in Arabic letters, English letters, and sociolinguistics jumping out of the page in quotes because he could not find it in the dictionary. Well, that didn't fly, and we ended up with socio-medical, which paralleled biomedical and seems to have stuck. As I
Sounds
said,
very
I
logical.
think it's larger than any of the other departments
Yeah.
in the School of Public Health now, and
And
it's flourishing. It has had psychologists as head of it,
Uh-huh.
and it had psychologists like Doran Wind,
Oh, yes. Yeah.
not Bruce, but Barbara Doran Wind,
Barbara.
the wife of Bruce Doran
Yes.
Wind.
For whom we did work also.
Yes.
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 Numerous study.
Yeah. And I have sociologists like Eugene Litwack.
Yes. Yes.
And now we have an anthropologist. So I think we're covering the field pretty well.
What's the name of the current person?
The current name is Richard Parker.
Uh-huh.
He's well known for his work, especially in Brazil,
Uh-huh.
and globalization, global issues having to do with the spread and treatment of
SARS.
AIDS.
No.
AIDS. No, this is before SARS.
Yeah.
SARS is fairly recent on the
I know.
horizon,
I know.
and nobody knows where that is
I
going.
know. I know.
So that's where we have been.
Have we concluded our discussion or
I think we've
covered?
covered
Pretty
a
much.
lot of ground of the War Department,
Yeah.
of NORC.
We just didn't
Columbia
mention Allen
University.
Ginsberg as our coder. We forgot to
Oh,
mention Allen Ginsberg.
That's right. We were
an
going
NORC
to
coder.
ask you about the famous coders you have had, because coding was a job which people who in other professions who didn't have steady jobs, like actors and actresses,
Many.
were very happy to take.
Many,
And that included
many.
some poets.
Right.
And the poet was
Allen
Ginsberg.
That's right.
And I think that's
For
a
a brief
nice
period of time.
a nice note to end
Yes.
on.
Okay. Well, thank you.
Thank you, Pearl. We didn't say, and this may not get into the script, but I invited you to join the Columbia group
No.
as head of our field department, and I could not convince you to leave NORC.
That was
And the reason was you told me that Paul Sheatley said, oh, you would be narrowly concerned with health surveys, and would not be in
wouldn't have the wide
the wide
spectrum
range of surveys for the State Department on
of actually it
how
was
we-
Norman Bradburn.
Norman Bradburn was.
Was Norman
Who
Bradburn.
did that?
He did
I
that.
see.
I think
He's now head of the...
I think Paul may have been gone by that. No, I'm wrong.
Yeah.
No, but why was it? Oh, Paul had already gone to Chicago.
So here's to
by
you,
then.
Pearl.
To your
And
health.
to AAPOR. Are you
And-
going to the meeting in Nashville?
No, I don't think so. I hadn't thought about it, to tell you the truth. I've been reading the AAPOR material. I'll
Yeah.
go to the New York
it's a
AAPOR
great,
meeting.
It's a great program.
Yeah, it
And
is.
Eleanor Singer's putting on a good
Yeah.
show on privacy, the issue of privacy.
Yeah, this at New York AAPOR.
At the New York AAPOR.
I'm going to that. Yeah.
I think that's
Well,
it.
Have you turned us off?
I think that's it. That's pretty good. I'll set out.
Okay.
Okay.
Actually, when they both sit together would be a good fade to black time, because you both sip water at the same time. That would have been a
Oh.
good ad, right?
Okay.
All right, terrific.
Okay.
Here and here. Yeah, okay. Wait there for just a couple seconds.
Do you think we'll get a copy to look at?
Oh, sure.
Just sort of
And nodding.
We're going to go from one camera to the other.
Okay.
Okay.
We don't need sound for that.
Should we talk or
No,
not talk?
No speaking at all. Wait, I got to turn the AC off because it's the lights going to start flashing.
You don't want us looking at this anything.
Mike, you got a close up? Hold on. Let me get it better than that now.
It's hard not to talk.
No talking. You're nodding. Listening, no way. Sorry. Listening, nodding in a very interested manner. They just made a good point, and you're like, that's,
Mm-hmm.
So right now we're on the gentleman. And back to yourself. And we're going to do this just for a couple of minutes back and forth. And raise your eyebrows, smile. And, he just made a very interesting point to you. We're getting about 30 seconds. seconds, probably. Just listening. Very good, very good. Dr. Duffy, the gentleman. You can stop, man.
Okay. Thank you.
Okay.
No, the gentleman, you keep going.
Keep going, Jack.
Jack, yes, sir. Nod, raise eyebrows, maybe even shift a little back in your chair as she makes an interesting point to you during the interview. Very good. Thank you so much.
Okay.
Thank you.